Hello guys, how are you doing? I hope you are doing well and welcome to today's learning session. Today I want us to talk about poisoning or organophosphate poisoning. And before we start learning, I want us to understand that we are all created different and we all handle stress differently. So a stress that you can handle, you can find that a friend cannot be able to handle such kind of stress. And so I'd like us to understand and stop judging people. If you find a person who has attempted to kill himself through poisoning, please help that person to reach the hospital as soon as possible so that he can get help. And we all understand that life is not easy. Life is not easy. We are all struggling, and some people might reach a point that they feel that I can't proceed because maybe there is no help. People don't have jobs out here. People are having issues in their relationships, domestic issues, and people someone can feel like he or she can't handle the stress and decide to end their life. But if it happens that you come across someone who has taken poison, please just help them to get to the hospital so that they can get help as soon as possible. So today we are going to discuss about organophosphate poisoning. And organophosphate poisoning is a poisoning that occurs or results from organophosphates. It is poisoning due to organophosphates. And organophosphates are a group of chemicals that are used both for industrial and industrial and domestic settings. It is a group of chemicals used in both domestic and industrial settings. So examples of organophosphates, we have insecticides. Insecticides are chemicals that are used to kill insects. We have herbicides, chemicals that are used to kill weeds. And also we have flame retardants. So organophosphates can occur as an occupational exposure. Maybe someone is working in an industry, let's say these industries that make these chemicals. Someone can be exposed to these chemicals, during job time, or it can occur as a result of a suicide attempt. It can occur as a result of suicide attempt. So, as we have said, people working in these industries, you can get an exposure from the chemicals. You need to go to the hospital. And also, it occurs, and commonly it occurs as a suicide attempt. So many people, when they want to end their life, they just prefer using chemicals. So what are the symptoms of organophosphate poisoning? Number one, someone who has taken this poison or the chemical. The most common chemicals that people take, we have a dip. We also have herbicides. There's a chemical that is used to kill weeds. People like using it so much. and also we have insecticides. So what are the symptoms of someone who has taken poison? Number one, we have a very high heart rate. Number two, we have high hospital, and the blood pressure is checked. That is when the doctor will notice that the patient will have a very high heart rate. The patient will have low blood pressure. They will have bronchospasms. They will have respiratory distress. They will have nausea and vomiting. They will vomit. They will be vomiting. They will have abdominal pains, diarrhea, hypersalivation. Hypersalivation. They produce a lot of saliva. They will have increased lacrimation. This means they will be tearing a lot. We have excessive sweating. We have restlessness, confusion, tremors, seizures, and we also have coma. This is more of a complication. So the visible ones, once you come to contact with a patient who has attempted suicide through organophosphates, the ones you can see is hypersalivation. You will see the patient producing a lot of saliva. You might see the patient having seizures or convulsing. There is a lot of tearing, producing a lot of tears. They will be restless. Yes. They will be confused. And also, you will see diarrhea. You will see them vomiting. And also distress. Okay, these are the symptoms of organophosphate poisoning. So once you notice that a workmate has taken poison, you will see these symptoms. Please rush them to the hospital. So how is the diagnosis made, or how can someone know that the patient has taken organophosphate? Through history taking. Most of the time, these patients who come to the hospital with organophosphates, the informant or the person who brings them, most of the time they always know that the person took the chemical. And also through these symptoms, also the person who has taken poison, just you will hear the smell from them, or from their clothing. So what is the treatment of organophosphate poisoning? Treatment. First of all, decontamination. If someone has taken poison, number one, remove him all the clothes. Remove him all his clothes or her clothes. If the poison came to contact with his eyes, make sure you rinse the eyes. If the person is in the hospital, rinse the eyes with saline. If he is at home, before getting to the hospital, make sure you rinse the eyes with water, clean water. Also, wash the person with soap and water. And once you remove him the clothes, please make sure you discard those clothes. Number two, we have airway control. Once the patient gets to the hospital, the oxygen levels will be checked. If low, the patient will be started on oxygen therapy. And also, before you get to the hospital, on your way, make sure you position this person in a way that he can be able to breathe. Make sure the airway is open, but tilt the head to the backwards so that the airway can be open, because the person will be having a lot of secretions, a lot of saliva. So make sure the airway is open so that he can be able to breathe. Once he gets to the hospital, cannulation will be done. Get the patient a cannula. If the blood pressure is low, okay, it's always low, the patient will start on IV fluids. And also he will start on medications immediately to reduce the increased salivation, increased lacrimation. He will be started on medication, and we have atropine and diazepam to reduce the convulsions. If this person is in severe distress, he might need to be intubated. And this one will be done. But this is a patient who will need ICU care or HDU care. He will be intubated. Intubation, simply I mean, there's a machine that will help the patient breathe. That is if is in severe respiratory distress. That means the lungs are in distress, he can't breathe well. So if the person swallowed the chemical, he will be given activated charcoal, yes, to absorb the chemicals. Avoid inducing vomiting. Because if the person swallowed chemicals and he vomits, they are corrosive. Chemicals are corrosive. So that means they are going to burn his esophagus and mouth if he vomits them. So he's going to get burns. So avoid inducing vomiting. There's something called a gastric lavage. A gastric lavage is when a tube is used to rinse the stomach. The tube will pass through the nose or the mouth to the stomach, and then the stomach will be rinsed with saline, normal saline. So to get rid, but this one will happen if the patient consumed this chemical in large amounts. So when you come to the hospital, please ensure you make sure you tell the doctor the amount of the chemical the person consumed. So this tube will be used to rinse the stomach using normal saline. But this gastric lavage will only happen if you reach the hospital within 1 to 2 hours. Past that, the lavage won't be done. Yeah, because most of the chemical will be absorbed already between 1 to 2 hours. So, and then this person needs to be hospitalized. He must be hospitalized, yeah, for close monitoring of the respiratory system. Okay, so what are the complications? If they shut, that means that is the end of your life. We have renal failure, because your blood pressure will go low. That means your kidneys will not get sufficient blood and they will shut down. We have coma. You will go into a coma. And then the most serious complication, all these people who have taken poison, have high chances of getting stomach cancers. Very, very high chances of getting stomach cancers, because you ingest chemical. You ingest a chemical to your stomach. So you are at risk of getting stomach cancer. So when you come to the hospital with a patient who has taken poison, ensure you come with that bottle and show the doctor the suspected poison, and then be keen to note the time the person took the poison. Be keen to note the time. And then a study showed that 12 out of 71 patients who attempted suicide through organophosphates died. 12 out of 71 patients died. So yeah, you can simply die. So what I can advise is that why take poison? Why take poison? You will be rushed to the hospital and you will be saved. Your life will be saved. And once your life is saved, you will have exposed yourself to so many problems. Number one, that chemical will just corrode your stomach. You will get a gastritis, you might get a peptic ulcer, and also the most serious one, cancer of the stomach. That is a long-term effect of organophosphate poisoning. So please, let's avoid OPP as much as we can. Let's just avoid, because you will be taken to the hospital unless people will not notice. Otherwise, you will be rushed to the hospital. You will be given medications. You might make it or you might not make it. And if you will make it, just imagine all these expenses in the hospital, in ICU. It's very expensive. So if you can try to handle your stressors so that you can avoid to getting to a point of attempting to kill yourself. Actually, it's a sin. Attempting to kill yourself is a sin. So yeah, this is the short discussion. If you come into contact with someone who has taken poison, help them reach the hospital very, very soon so that they can be saved. So thank you so much for tuning in. Please don't forget to subscribe, don't forget to share, don't forget to like, and don't forget to always come back, because we will be discussing so many topics. And also you can also suggest what you want us to learn so that we can prepare and learn. Thank you so much.